new connections that we're working on so that everyone's aware. We're working with our WellPass participants that take care of patients that are in the Arkansas Department of Corrections. So we're working on a connection there because they have multiple clinics across the state, and we're really excited to work with our counterparts there so that when that particular patient comes out of the Arkansas Department of Corrections into the civilian world getting care, that we would be able to see what's going on out here in the communities in Arkansas. We recently are working with our, the Dardanelle Hospital was recently acquired by the Conway Regional Health System, and so it's Dardanelle Regional Medical Center and their clinic. So we will be bringing them on. They're in Dardanelle. We're really excited about that. We're also working with Ozark Community Hospital of Gravette and their clinics, and going to be bringing them on. And this fall, the Mercy hospitals we've been working on for a while, all of the Mercy System ambulatory clinics will be sending CCDs, continuity of care documents, to share. We also are working with Washington Regional Medical Center clinics, and they span all the way from Lincoln, Arkansas, all the way to Harrison. Specialty, urgent care, primary care, and we have a set go live date of this next month for all of those connections. We're also working with our Missouri Health Connection to get that if an Arkansan goes to any of those connected facilities up there like Cox Health or Mercy, Jewish Barn, that information will flow over. Had a question. Amy, I will answer your question on the CCD, but that's a great question. I'll just have to read through it to make sure I answer it correctly. And please share how you're able to assist CINs in ACO work. And this is from Wendy. Wendy, yes. So what we are doing, we are working with a couple of different accountable care organizations across the state and CINs, recently connecting to the Baptist Health Physician Partners. And we're also working with the Arkansas Children's Care Network. We are soon to be working with the Northwest Health Alliance up in the northwest part of the regions, and we're also working with an independent that works with independent providers called Aledade across the state. So we are working with CINs that are working in the ACO world, and what we are doing with multiple of those is that we are getting the patient attribution directly from them every month usually, so we can capture all of those beneficiaries. And this is not only available for CINs, this is also available for every clinic. You have multiple patients that have different insurances, whether it be Blue Cross, if they're on Medicaid. If you're in the PCMH program, we're already notifying you. But they could have Aetna, United, self-pay. We can capture those. So all of our connected hospitals, we're able to send, we get that attribution, and we're able to then notify the care coordinator, the doctor, in one daily report. For a lot of you, you're getting your Medicaid patients notified, but we now have over 500 independent locations that are receiving, and these are satellite sites and et cetera, they're receiving the daily reports on their patients. So for an ACO, this is really important because you are held to certain metrics. In a clinically integrated network, you're able to see when your patients go to the ER and the date and time so that you can follow up with them. Keep those readmissions low. You can prevent those readmissions from occurring, and then be able to see actually what is going on with the particular patient outside of your particular, maybe you're just working in an Epic system, but you have patients that go to multiple facilities. We're able to assist through that process. So as you see here, I like to bring up this that we just did with Baptist. We created this little, this could be a CIN or an ACO, but essentially shares in the middle here. We have ancillary providers. we have independent providers, and then we have maybe 4 hospital systems: an Epic hospital, a Meditech hospital, a CPSI or Evident, which a lot of our critical access hospitals use, or Cerner Hospital, behavioral health. Essentially, that data is flowing back and forth, but then also we can have that data flowing to the clinically integrated network. Let's say they're using a sophisticated analytic platform that they want the admission discharge transfers to flow to. We can do that as well. So multiple array of different ways that the HIE can be able to assist facilities or CINs such as Baptist Health, or we're working with Arkansas Children's Care Network to get all of their pediatric practices integrated so that we can start doing some analysis and making sure that we're getting the correct metrics, et cetera, and that the ACUCN is really working on that, not broader than just Medicaid patients. Wendy, did that answer your question? Or if not, we can maybe have a sideline on talking about it a little bit more. If you're just jumping on, remember that you can be able to chat, use the chat function. Okay, so remember on the 24-hour daily reports, this is available to everyone right now. We're actually notifying 28 behavioral health practices on their patients when they're going to the emergency room and inpatient, because a lot of those are getting intensive therapy, and they need to know, the psychiatrist needs to know when they're going to the ER, and they are following up with the patient. We have some specialists that are doing this as well. We actually have some dental clinics that are attached to an that are part of a FQHC that we're notifying on. So this can really be able to help facilities on the patient attribution. This is run over the 24 hours. It gives you one report, and usually if you have multiple sites, it's separated by if you have multiple sites, it's by that clinic. So it goes to those right individuals. If you're a hospital system and you haven't joined SHARE, or that you want to know more information about 30-day readmissions, we actually notify if the hospital is connected to SHARE. We're sending you 30-day readmission notifications. This is a great way for you to be able to see those patients that are continuously being readmitted when they leave your facility, and then we notify you where they showed up. We know that there's nothing that a hospital system can do then, but they can start flagging or risk stratifying their population to be able to see those high utilizers of the ED, or the high utilizers when they get discharged from one hospital and then 2 days later go to another hospital and get admitted. So they can see and start doing some analysis on what's going on. Yeah, so if you are a patient-centered medical home with Medicaid, we are part of that program. If you are not connected to SHARE, you need to send me an email. I know there's several clinics that are not connected that are in PCMH Medicaid. I encourage you to connect. We're continuously to grow, and the program this year, it really puts an emphasis on ED and inpatient discharges. So if you're not following up with them, your metrics are not going to look good, and your per member per month will be less, because there's a big emphasis on ED and inpatient discharges for your population. So send me an email, and I can get you squared away and move to the next steps. Let's move to Health Information Exchange, where we integrate with your system in CCDs, continuity of care documents. Let me take you to MIPS, because I think a lot of you may be going after MIPS, or you're in a MACRA, and you have different, you have a quality of cost, improvement activities, and then promoting interoperability. And so through MIPS, or through, if you're a hospital going after promoting interoperability program, which was formerly Meaningful Use, we can be able to assist you through this. Those programs essentially want you to be able to integrate and share continuity of care documents. So essentially what that means is that if I am going to a clinic and I'm registered, if you're integrated with SHARE and I'm registered let's say I go to the pediatric clinic in North Little Rock, and I'm on their Athena system. Essentially, and that I've been to Arkansas Children's Hospital a couple times, but my parent never has called the provider. You've been notified, but and then finally I get the care coordinator sees the daily report and gets me in to be seen. Well, based upon in your practice management side, it looks for the night before all the patients that are registered to be seen by the provider. So as I've just stated, the use case is that I've been in and out of Children's Hospital. So it's going to automatically look out there to see if there's any information, laboratory results, radiology reports, and bring that forward in a continuity of care document. And so during that, you're really working on those transitions, you're bringing in those clinical, those results that happen outside of your hospital, and then really working with the particular patient. So as you're going through, this is just a one-page how we can be able, as a health information exchange, we can be able to assist facilities that are using, you know, going after MIPS, MACRA, promoting interoperability program. As you know, we are a value-based state throughout the nation, and we're assisting across the board. Whether you're a CIN, as we talked about, or an ACO, how we can do that, or if you're going after MIPS and MACRA, or if you're a CPC Plus, you know, next year will be the last year for CPC Plus, and then it will roll into, we're already selected as a primary care first state, and through PCF, one of the requirements is to integrate with your HIE. So I want to just bring that to your forefront if you haven't looked up patient or primary care first, and all the CPC Plus individual practices will be able to sign up for that next year. But if you aren't a CPC Plus, you can sign up this year for 2020. CPC Plus practices, remember, you can be eligible to start in 2021. And one of the premises is you'll be integrated with the health information exchange. You know, I always say, you know, when you're faxing the records, do we know actually who it, I mean, we type in a number, but do we know who actually receives it on the other end of that medical record? Is it secure? Those are all questions to ask yourself when you're faxing over a medical record for a particular entity or a patient to a separate entity outside